Until the late 20th century, women were routinely excluded from major heart disease clinical trials. Researchers assumed the findings from male subjects would apply to women equally. For decades, that assumption shaped the treatment guidelines, the diagnostic criteria, the public health campaigns, and the image burned into most people's minds of who heart disease actually happens to. That image was never a woman over 50, but heart disease is the leading cause of death for women globally. Not cancer, not stroke, heart disease. And the gap between what most women believe about their own cardiovascular risk and what is biologically true right now in their bodies is one of the most important gaps in women's health today. Here is what that gap looks like inside the body. For your entire reproductive life, estrogen was doing something to your cardiovascular system that it never announced, and that nobody translated for you into plain language. Most people think of estrogen as a hormone that manages reproduction. It was also managing the inner walls of your blood vessels, keeping them smooth and able to respond. It was maintaining a balance in your cholesterol that worked in your heart's favor. It was buffering the kind of inflammation that travels through your vascular system and causes damage over time. You did not need to know any of this was happening. It just happened. Every day, and then the menopausal transition arrived. And that quiet cardiovascular work gradually wound down. Most women felt the hot flashes. Most women noticed the sleep changes. Almost none were sitting in a room with someone explaining what was simultaneously shifting in their heart. What happens to the cardiovascular system when estrogen leaves is not a collection of separate problems. It is one chain of events. The balance between the types of cholesterol in your blood shifts. The form that builds up along artery walls begins to rise. The form that protects against that buildup begins to fall. Over months and years, that imbalance creates conditions for plaque to accumulate in artery walls where it was not accumulating before. As plaque builds, arteries lose the flexibility they had. They stiffen. They become less able to widen and respond. A stiffer artery means the heart has to work harder to push blood through it. That added effort begins driving blood pressure upward. Quietly. Without pain. Without any signal that it is happening. And that rising pressure meets the chronic low-grade inflammation that follows estrogen loss. If you have spent time on this channel before, you have heard about this inflammation in relation to joints and sleep and brain health. It reaches the cardiovascular system through the same pathway, the same biological shift. A different destination. One thing causes the next. That causes the next. There is no moment where it starts and no alarm when it does. Just a biological story unfolding at a pace slow enough to miss, but significant enough to matter enormously now. There is something this video needs to spend real time on that most general health content does not. The way a cardiac event presents in a woman is frequently different from the image most people carry. That image comes from decades of research and public health communication built almost entirely around male experience. A dramatic sharp pain in the chest. Clutching. Collapse. That picture is real for many people. It is not the whole picture for women. Women more often experience jaw pain that arrives without explanation. Pressure across the upper back. A wave of nausea that connects to nothing eaten. A sudden exhaustion so deep it feels unlike any ordinary tiredness. Shortness of breath during unremarkable activity. A sense of fullness or pressure in the chest rather than sharp, dramatic pain. These are documented. They matter. And the most important reason to know them is not anxiety. It is so that if something feels genuinely wrong in your body, you do not talk yourself out of taking it seriously. If you experience symptoms like these, please contact your healthcare provider without waiting. Trust what your body tells you. Before menopause, women have meaningfully lower rates of heart disease than men the same age. That is estrogen working. That is the protection we just described, running in real time. After menopause, that protection changes. The cardiovascular risk for women rises to meet men of the same age, and that rise does not take decades. The acceleration begins within the first years after menopause ends. Consider what that means for a woman who spent her entire life hearing that heart disease is a condition that happens to men. She was not wrong to believe it. She was working with incomplete information. And the body she has now operates under completely different conditions than the body she had 10 years ago. That is not a reason for fear. That is a reason for a different kind of attention. So, what does a woman do with all of this? Blood pressure is where the conversation has to begin. It is the clearest and most immediate window into what the cardiovascular system is doing. It carries no symptoms. It announces nothing as it rises. Millions of women carry elevated blood pressure for years without knowing because nothing hurt and nothing felt different. Finding out your numbers is not a medical procedure. It is the most useful piece of information available to you right now for your heart. If you do not know them, that changes this week. Movement is what research points to most consistently for cardiovascular health after menopause. Not an intense exercise program. Consistent walking. Most days. The kind of movement that asks nothing dramatic of you and returns something significant over time. Arterial flexibility. Blood pressure. Inflammatory markers. All of these respond to regular moderate movement in ways that are measurable and real. What lands on the plate most consistently shapes what the cholesterol balance does. A pattern that centers vegetables, fatty fish, legumes, and whole grains works in the direction of the protective form of cholesterol and away from the harmful form. Not a temporary diet, a consistent direction that compounds quietly the same way the risk does, and the stress that most women over 50 carry without numbing it. The elevated cortisol. The chronic low-grade tension that has become so familiar it no longer registers as stress. It reaches the heart. Managing it is not self-care in the soft sense of the word. It is cardiac biology. Heart disease is the leading cause of death for women. That sentence deserves more than a moment with it. This week, find out your blood pressure numbers. Write them down somewhere. That single act of paying attention is how this conversation moves from something you heard once into something that actually changes what you do. If this video shifted how you see your own health, share it with a woman in your life. Leave a comment telling me one thing you are going to do differently for your heart starting now. One thing. That is all it takes to begin. Subscribe to Better Life Daily. This channel exists on one belief. Women over 50 deserve to understand their own bodies completely, starting with everything nobody warned them about.